Hello and welcome to NJBIZ Conversations. I'm your host, Jeff Kanij. My guest today is Saad Ehtisham. He is the CEO of Atlantic Health. Saad, welcome.
Thank you, Jeff, for having me.
Thanks for taking the time to do this. I appreciate it. You've been in your current role since last summer, if I recall correctly. You came from Novant Health in North Carolina. So I'm curious, before you took this job, what you knew. Well, first of all, a belated welcome to New Jersey and congratulations.
Thank you. Thank you.
And that's where I wanted to start, which was what did you know about Atlantic Health and the healthcare landscape in New Jersey, and what attracted you to this position?
So, a great question. I knew about Atlantic Health, the reputation of it. Interestingly enough, years ago, I was at a conference and there was a session about how to engage employers in the care journey, and the speaker was Brian Gragnolati.
Gragnolati, sure.
And so I happened to attend that session, so I heard a little bit about Atlantic. I was like, this is interesting. They're doing some pretty neat stuff, pretty advanced stuff for the time. And so I tucked that away, years went by and I would, glance what was going on in the Northeast. You keep up with what's happening. I knew about RWJ before the Barnabas. Now it's RWJ
Okay.
Barnabas. I knew about Meridian. I knew about Hackensack. So I knew about the players in and around Cooper as well. And so kept an eye on this region and, mostly you learn from others.
Mhm.
And so Atlantic, I had an eye on. And then when this call came, I was like, interesting. And I was curious. Now, I'll tell you, full transparency, I've always worked in the South. I've never worked north of the Mason-Dixon line.
Okay. Well,
So,
welcome to Blizzard Land.
oh, it sure is the blizzard land these days. And so I had made a promise to the wife that I would never work in the north. And but when this opportunity came, I was like, oh gosh, this is an amazing opportunity. So I got to sell this. So I sold my wife on the fact, hey, our nephews live in the city and Megan is in Boston, driving distance
Yeah,
train.
right.
I think you'll be near family. We should look at it. So I got the green pass,
Okay.
and then we ended up here. And within 2 weeks of being here, my wife loved it. So
Oh, good.
back to your question, I knew about Atlantic Health. I knew what they were doing. I didn't realize how great an organization they were till I really took a full look under the hood, so to speak. And it is just fantastic. I'm blessed to be here.
Okay. Well, yeah, you mentioned Brian Gragnolati. I mean, yes, he was involved in the American Hospital Association very deeply for a
Yeah.
while. And Atlantic Health has a couple of the most highly regarded hospitals in the state. How do you see your role now in terms of the history, the legacy of the company and the kind of care it provides?
I thank Brian on his way out that he's left me, a health system that is very robust, healthy, quality-wise, stellar, amazing quality. And now it's an opportunity for me to take it and take it to the next level because I still think there's always room for improvement, even though we're among the best in the state. And I believe a press release is coming out today that will announce that we're among the best in the world.
Okay.
Uh,
For that.
yeah, Morris Atlantic Health Morristown Medical Center. I believe I can now say it is number 51 in the
Oh,
world,
okay. In the
and
world.
Overlook
Okay.
is 183 out of all the hospitals, and so you'll get to read about that. So we're 51, 183. Like to get the 183 in the top 100, top 50. Want to get the 51 ranking in the top 10, and then work towards. I'm very competitive, so
Okay.
I don't like being second best to anybody. So I feel like there's still great room for improvement for us. And what a blessing that is for our community to be able to experience that type of healthcare that's at the top, among the top in the country, and a blessing for New Jersey because New Jersey deserves the best healthcare in the country, because that helps us in different ways to attract businesses.
Okay. So what has the experience been like so far? Has it lived up to your expectations, or has something surprised you? What's your main takeaway from the last, whatever it's been, 8, 9, 10 months now?
Yeah, whatever the time frame is, it's the culture is just amazing. Jeff, I would tell you, I've not experienced this type of culture anywhere. The people are committed to the mission. They're committed to serving the community. They're committed to serving the patients in the way they want to be cared for. So that's just been the best part of this whole thing.
Okay.
Now, are there room for opportunities to do better? Yes, I do see things we could do better. I see there's a lot of friction, and as that's the case in most health system, we're very complex. It's hard to navigate a healthcare system. If you tried to, I hope you stay healthy for a while. But if you do, you'll find it's not that easy to navigate.
It's not.
And so I see that as an opportunity for me to be able to just create that friction and reduce that and take the complexity behind the walls like
Okay.
Disney, and then make it easy for people to access our health system.
Okay, very good. I wanted to switch gears a little bit and talk to you about some of the challenges that the industry is facing right now. First, I'm curious what you make about the policy changes coming out of Washington, starting with the Department of Health and Human Services and the CDC and some of the moves they've made with regard to public health. I've talked to several of your peers in recent weeks, and some of them are kind of alarmed by what they hear. And at the beginning of the new administration, we're willing to sort of wait and see how things were going. What's your assessment now of some of the policy changes coming from the bureaucracy, from the administration, from the agencies?
It's certainly concerning in the fact because it's creating confusion,
Right.
right? It's creating confusion for all these years. We have said, vaccinations have a purpose, they have a benefit, and now all of a sudden the policy shifts. We don't need to vaccinate. And there was always a segment of parents who did not want their kids vaccinated.
Mhm.
And to me, the parents should have the freedom to do what they want to do as their child at the end of the day, but I think they should be given all the correct information. So
Mhm.
there's a lot of misinformation. Our job as health system is to continue to put the correct and most accurate information in front of the community, and
Mhm.
the benefit and the risks that are associated with it. There's always a risk associated with something.
Mhm.
And so while it's alarming, I've taken the position that we should continue to educate our communities that we serve on the benefits of vaccinations or other policies that contradict otherwise, and let the community make the decision the best they can. But we have to put the facts out there.
Okay, yes, and that's something I've heard over and over again. Is that's particularly with regard to public health, correct information, useful information is really vital, and there is a role. What I hear you saying is there's a role for Atlantic Health to play in making sure that happens.
Absolutely, because at the end of the day, it's about trust.
Hmm.
We got to create trust with the community that they can believe what we're telling them is in their best interest and is grounded in the belief that we care about them. And so we got to earn that trust back. Some of that has been eroded over the post-pandemic, but a lot of health systems are dealing with the same issue of misinformation. You go yesterday, I was scanning through, I scanned through social media, and I was going through X,
Hmm.
and there was a picture off a bill, and it's only a one little portion at the bottom, and there's a big arrow that says in bold, "Pay your bill," and the bill's 9,000 some change, and the caption says the person that I delivered a baby, and this is my bill, $9,000.
Hmm.
And so I'm looking at the bill. That's not a hospital generated bill. I'm thinking this is a bot generated bill. This is a bot
Right.
generated social
Right.
media post. And people are going to believe that. Now, you can't counter all that. We don't have time for that. I just happened to be scanning and I saw that it caught my eye. And so that's an example of the misinformation out there, and
Right.
people believe it. And so we just got to keep pounding the facts, got to keep using American Hospital Association as a venue to be able to put facts out there and continue to defend the beliefs, and what we need to do is in the best interest of the community.
Okay. And then shifting over to Congress, I'm curious what you make of some of the cutbacks in health insurance programs and Medicare and Medicaid. I mean, that's got to make your job a lot harder, doesn't it?
It sure is making it harder, but it also never let a a crisis go to waste, right? And so in
Right.
that, I also see the opportunity that it's going to force us to redesign our care delivery in a way that matches the reimbursement we're getting. And
Okay.
so yeah, I see that also as an opportunity. But we're also seeing ways on how we can offset the impacts of the HR1, the One Big Beautiful Bill Act,
Mhm.
on Medicaid population who may be in the exchange and may not have any insurance. So earlier today, I was just talking to pick 3 locations where it's important for us to establish clinics where we can enroll Medicaid beneficiary to come to those clinics to seek care regardless of irrespective of their ability to pay or not pay. So that's where Atlantic Health is going to take the stance that we have a duty to serve and
Okay.
provide care. So that's what we're doing.
Okay, and then let's shift to some. Actually, let's start. Let's stay on the government side, and just because we have a new administration here in New Jersey, I'm curious whether you've had any contact with Governor Sherrill or administration, and whether you've heard anything that you find either encouraging or concerning from what she said during the campaign, and then what she's been her approach as she's gotten her administration up and running.
Let me unpack. There's a couple of
Okay.
questions in there. Have I had any contact? Governor Sherrill and I met during the campaign. We haven't had a chance to connect since she's been elected in. But Kelly Doucette, her chief operating officer, we had a call before governor was sworn in, and we've met subsequently
Okay.
as well. So that's an extension of the governor's office.
Right. Sure.
Her approach, the way I'm looking at it, is she's assessing the environment, she's evaluating, and then she's proposing and taking a proposed approach, which is very measured approach. I really appreciate that approach.
Good.
It's pragmatic, and so the approach, what she had said she wanted to do in the campaign, I believe in the early days she has been able to hit some of those things on the cost of healthcare, prioritizing affordability, looking at the extending the pandemic era waiver so people can kind of get the correct supervision, and then also the budgetary constraints that are related to the health insurance costs for the state employees, and looking at reference-based pricing. So I believe she is moving in the direction she said she was going to do. So I'm excited to continue to partner with her in her office and
Okay.
advance her agenda.
All right, very good. All right, then, in that case, I'm curious about some of the sort of longer-standing challenges that the industry has faced. Let's start with the difficulty in hiring and retaining physicians and nurses. It was a huge issue a couple of years ago coming out of the pandemic. I'm told that the situation is a little better now. What is your assessment? What's your perspective? What's been your experience at this point in terms of particularly with nurses and doctors, since that's where most of the trouble seems to be.
Sure. And each health system is dealing with that at a different level. And it goes back to the culture. Do you have a culture that is conducive for team members to want to stay and work, physicians to want to practice? So I believe we have that at Atlantic Health. Our team member engagement scores are in the 82nd percentile, which is among the best in the country.
Mhm.
And we've been able to reduce our nurse vacancy. During the pandemic, our nurse vacancy was in somewhere between 25, 28%. Most recently, I just asked for that where we are, and we're just a little over 10%, which is
Okay.
really, really good. And we're being very transparent about it. We're not, there's ways to game the system. It's a ratio, right? So you can game the system. But and I looked at it, we're at 10%, which is really, really good. I think we can drive it a few points further south. Physician recruitment, at this point, we're lucky enough because we are near the city. We're in an urban environment. North Jersey has a lot to offer to be
Mhm.
able to attract physicians. So we're lucky in that aspect. But I do see a shortage of physician looming, especially in New Jersey around primary care. So that's one challenge that we're going to need to partner with the governor and others to figure out. Medical schools, how do we solve for that? And I think affordability in the state becomes an issue there as well. But the clinical burnout is one that you may have kind of danced
Indeed.
around a little
Mhm.
bit. That's a real thing. That's real. And there's a question in Epic that measures the burnout on a shift basis. So if you're working an 8-hour shift, it asks you the question, how are you feeling? And it's a 5-point Likert scale. And in a 12-hour twice. So I'm going to have that turn on so we can measure real-time data and be able to give that to our leaders in those units to say, hey, this is how your team was feeling, what was going on. So I think the more we talk about it, because you got 6 different generations in the workforce,
Hmm.
and the approach is very different from a Gen Z than it is from a Gen X or a baby boomer. I think
Sure.
they require a different level of engagement. So we focus quite a bit on that. And then we're looking at different ways to attract physicians to be able to want to come or encourage physicians. I'm contributing towards that. My oldest daughter, who's a graduate of Florida State University,
Oh, congratulations.
thank you. She graduated last May and she's starting med school this summer.
Oh,
So
very nice.
I said, hey, there's a shortage. Why don't you go help out the country? So
Oh,
she's
good.
going to go do that for
Very
us.
good. Okay. Similarly, I'm curious, and you mentioned burnout because I want to talk next about technology and I'm first of all the changes that you've seen from technology. It was accelerated during the pandemic and it's continued up until now. And there are some in the industry who believe that, especially artificial intelligence, can play a role in sort of dealing with the burnout question. Where do you stand on technology? How are you using it, and where's the best way to spend your energies on that?
Excellent. Well, Jeff, I'm a techno enthusiast. I
Okay.
grew up in technology. Now, I've also worked in healthcare when we charted on paper. There was no electronic medical record. So I'm not that old, but that should give you a frame of mind that there was not too long ago when I started practicing as a nurse, we wrote on paper
Hmm.
before we went to electronic medical records. So we've come a long way. Technology absolutely plays a part in reducing clinical burnout, especially through ambient technology. So we have deployed and we're testing Nuance. It's a DAC Copilot where it listens to the conversations with the patient's permission to be able to record, and then it captures that conversation into the record, and then the physician clinician can go in and edit and make sure it was accurately captured. And what's it doing for the clinician is it's reducing the time they have to go home after dinner, putting the kids to bed and sleep, get in their pajamas, and then dictate and do
Hmm.
all that work. So it's reducing that pajama time, we call
That's
it, but it's giving time back into the evenings to their families, right?
right.
And that's a mental stressor that we have just kind of liberated them from, not being able to spend time with their family. So technology definitely does play a part in that. 25% of the activities that the nurses do have nothing to do with nursing. And so all those can be automated through AI agents. So we're evaluating all those things to be able to liberate the nurse to be able to function at the top of their clinical abilities. Uh, the, the AI application on the clinical side, being able to go through the data fast and be able to put that right information in the right format at the right time in front of the clinician so they can parse through what the AI bot has done in going through the medical record instead of going through pages and pages or screenshots of screenshots. They can just see, here's the synopsis, and then make a clinical determination and go on about their business. So it's aiding in making decisions faster and more
Right.
accurately. So I think there's a whole untapped nature of AI and technology that we have not even applied. And we're beginning to look at that from a clinical side, administrative side, and also from human capital efficiency side.
Okay. So, given everything that we've talked about and the kind of things that you've mentioned, what do you see as the biggest challenges for the industry as a whole and for Atlantic Health in particular?
We're going to be faced with same challenges at every other health system. We can't predict and control what the policy changes are going to
Right.
come. So that's a given. It's going to come. There's no net new dollars coming in. So we
Right.
have to figure out how to create a more cost efficient system that the community trusts and is wanting to be associated with. So that's one challenge. The second challenge is going to be, it's really around the workforce. You hit that because we have an aging population. There's graying of in the United States happening. there's all this experience that is sitting right close to within the next 5 years, they're going to retire and walk away. All that experience just
Right.
walks out, that institutional experience walks out. How do we backfill that? And so we have to be proactive in encouraging people, students who are in seventh, eighth grade, to be considering healthcare as a profession for the future.
Okay.
And I think if we don't get that pipeline going, it's going to be a world of hurt for us. So that's the biggest challenge that I see that we have to kind of overcome.
All right. And so then what are the biggest elements to succeeding? What do you need? How would you measure success in terms of what you're doing, several years down the road? What do you hope to accomplish?
My hope is that we continue to be seen as the employer of choice. If you can continue to attract people to want to work at Atlantic Health because of the culture, because of the reputation, that in itself is a success. Then you look at it from the provider standpoint. It's not employed physicians. We have a lot of independent physicians who practice, and they're not associated or employed by any health system. I want them to be able to want to come to Atlantic Health and continue to want to come and bring business because we make their life easier. And we're there to help them continue to practice medicine and stay independent. And we want to help support them stay independent because there's a value in that. And then really it's the consumer trust, because at the end of the day, the competition is really not other health systems. The way I look at it, my view is our competition really is where the patient's perception is, where care is better, and provided there is access and
Mhm.
equal
Okay.
capabilities. So to me, it's defining that success around how consumers are seeing you, and are they continuing to use you at a pace that they did, in fact, at a greater pace. So, and then Atlantic Health continues to create access for those who are uninsured, underinsured, and disenfranchised. I think that's in our mission, and that's something we're going to continue to do. And we want to lead the way into making healthcare more affordable. So I would define our success in those buckets.
Okay, very good. And finally, before I let you go, I'm just curious about your outlook for the industry and Atlantic Health over the next few years. Are you concerned, worried, optimistic, cautious? How would you characterize the way you're looking at the future?
I love the word optimistic. I would
Okay.
also add optimistic and bullish, to be honest
Bullish.
with
Okay.
you. Yeah, I'm bullish about where we are as a healthcare industry. I think we're at a great precipice of greatness. I think we're going to continue to drive, and in Atlantic Health specifically, our 2028 plan that we rolled out is designed around leading the way of medicine in the United States and being seen as one of the top performers. And so I'm excited about where the future is going for Atlantic Health, and I'm excited about how that's going to serve the community. And it's going to be such a great thing because we're going to be elevating the care in the communities that we serve. And I'm so excited about that.
Okay, very good. That's a good place to leave it. Saad Ehtisham, CEO of Atlantic Health, thank you very much for joining me. I really appreciate you taking the time today.
Thank you, Jeff. It was a pleasure.
Anytime you want to come back, by all means, we'll check in again and see how you're doing.
Absolutely. Thank
Okay.
you.
And thank you for watching. Until next time, stay safe, everyone.